Hi, Kristy Harris here with Shapiro Plastic Surgery and Skin Clinic. I wanted to take some time today and talk about one of the skincare lines that we use here in the office, and I actually used for my model in the competition. And what I used was, I'm going to pick this up, the Obagi Nu Derm system. This is what the kit looks like. Looks like a lot, I know. It is the #1 sold medical skincare line in the world, so a lot of people know about it, but maybe you don't fully understand it. So I just thought I would kind of talk about what this system does. The first thing that I want to talk about is that it's necessary to use the entire line. Sometimes clients come into the office and they're really hesitant to get a kit. They just want to buy one or two things. And I sort of understand, because nobody wants to be sold something. You know, that you have all these products at home. Why can't I just use what I have? Do I really need everything? You know, it's kind of a big investment. I totally get that, but it is actually necessary to use the entire kit the way that it's intended. When you see these really amazing before and after pictures, those are real. That really happens. But it doesn't happen when the client goes home and does their own thing. That's not where you get those pictures. You get those before and after pictures when you're doing the system the way it's intended. And I know, because I know some of the people that you see in those before and after pictures, and they did it the right way. So again, I'm going to show you this. It's 6 steps in a moisturizer if you choose to use that. The nice thing about this is it tells you right on the bottle the order that you use it. So they're numbered 1, 2, 3, 4, 5, 6. It tells you right on the bottle if it's an AM, PM. This one's AM and PM both. This one's AM only. So it tells you right on there. So that makes the system a little bit easier. So we'll start with the first step. We'll go through a morning routine. You cleanse, you tone. So why can't I just use the cleanser I have at home? Maybe you can. Maybe the cleanser you have at home is perfectly fine. Or there could be something in it that is some sort of exfoliant, a dye, a fragrance, something that maybe dries out the skin or irritates the skin, and you using it with your current skincare may be perfectly fine. But when you start adding in hydroquinone and tretinoin, your skin may freak out. And then we don't know what's what. We don't know why you're reacting. So that's why we want to do this. The toner, it's not an astringent. It's not going to give you that tingling, astringent feel. It's really intended to restore the pH of the skin, to get it ready to accept the hydroquinone. And I'll tell you, the cleanser is our #1 sold cleanser in this practice. We sell several lines. It just gets all your makeup off, and I've even used it on myself after chemical peels without even going to a gentle cleanser. I still use the foaming. However, they do make a gentle cleanser. I just love the foaming. So, cleanser, toner. And I also want to say, you know, a lot of people want to use something really mild like Cetaphil and CeraVe, and I don't hate those things, but I don't know that they get the skin quite clean enough, or if there's a little bit of an occlusive barrier on there that might inhibit the penetration of your product. So if you're going to spend the money on something like this, you want to maximize its efficacy. Which brings me to the next point. Using clear alone, which is your hydroquinone, is not going to maximize its benefits. You need to use it with a tretinoin, and you also need to use it in the right dosage. So you're clear, this is an AM/PM product. There is 57 grams in this bottle. A standard protocol is 1/2 gram in the morning, 1/2 gram at night. That's 1 full gram a day, which means 57 grams should be done in 57 days. If your clear is lasting you more than 2 months, you're not doing it right. Then you have Exfiderm. So there's an Exfiderm Forte and a regular Exfiderm. The difference is Exfiderm has phytic acid, Exfiderm Forte has glycolic acid. One's for more oily skin, one's for normal skin. In our practice, almost everybody's on regular Exfiderm. It's just a little bit easier to tolerate with non-retin-A. Then, if it's daytime, you could put on your moisturizer. We have Obagi Hydrate. I'm a little bit more lenient if somebody wants to use a different moisturizer, as long as I know what it is and there's not something, an active ingredient or something that's going to irritate. Final step during the day would be sunblock. I love the Obagi sunblock. This is an SPF 50. It's matte. It has a lot of zinc oxide. This has 10.5% zinc in it, but it's a micronized zinc, so it goes on nice and sheer and doesn't look white. Now, of course, I live in the desert. It's hot. It's sunny here all the time in Arizona. But if somebody has rosacea or melasma, we are also concerned with inflammation. So the blood vessel dilates and you can get inflammation. If we use zinc oxide, it can help block out some of that heat, so that's sort of an added benefit in addition to the fact that it's a broad spectrum protection. And physical sunscreens, meaning mineral sunscreens, titanium and zinc, tend to be a little less irritating than chemicals, although this is a chemical and physical together. We have other things in the office, but I really do like this particular one. So at night, you would cleanse, tone, you would do your clear again, but you're not going to use Exoderm, that's AM only, and instead use Blender, which is also a 4% hydroquinone, with tretinoin. A lot of people just call it Retin-A. Retin-A is a brand, but tretinoin is the actual drug. We have this in 0.025, 0.05, and 1%, 1% being the highest. And you mix it with your blender. Now, I know that this is also 4% hydroquinone, but it's slightly different than clear. It's actually formulated in a way that's intended to be mixed with your blender, and you use that at nighttime. If somebody was on a really aggressive protocol, they could maybe do it twice a day, but that's extremely, extremely rare. Generally, I have a hard enough time getting people to use it just at night, even a couple times a week. So you mix the two together. This helps with the distribution of the pigment to the keratinocyte. So if we're only using straight hydroquinone, yeah, we're suppressing tyrosinase, and that will help reduce the activity of the melanocyte and lighten up pigment, but we're not addressing how that pigment is then being distributed to your keratinocyte. So you can't see melanin until it makes it to a keratinocyte. So we want even distribution, and that is why you have to have the stimulation of your tretinoin with your hydroquinone and some sort of exfoliant, but I like a more mild exfoliant when you're new to Retin-A. So there is a purpose to that. Sometimes we add in a vitamin C, has huge benefits, helps with the production of collagen, anti-inflammatory, antioxidant. But sometimes if this is a new client, I won't do a vitamin C right off the bat. And the reason is it does L-ascorbic acid, which is what I prefer to use, has a low pH, and it can be a little irritating when you're using Retin-A. So sometimes I let them start the creams, build up some tolerance, and then we can add it in later. If they've already been using a vitamin C, then maybe we'll continue with that. But I think literally every single person needs a vitamin C, just like every single person needs a sunblock. And going back to the sunblock, I tell my clients, if you're not going to have a good sunblock and you're not going to use it religiously, there's really not any point in moving forward with treatment, because we're trying to suppress the melanocyte. The UV light activates the melanocyte. It's very counterproductive, not to mention that we have the risk of skin cancers and it ages you, and who wants that? So you have to use a sunblock. That's literally the number one most important thing that you're ever going to put on your face every single day. Maybe if you have the flu and you're throwing up and you can't leave your house, you can get a free pass. But otherwise, every single day, sunblock, no excuses. And if you say, well, I put on sunblock, but I just tan easy, you're not using it right. If you're still getting tan, you're not using the right kind, not enough, or you're not reapplying enough. The other thing that I want to talk about is just how you measure this out. I like to tell people from the O to the A, thick like toothpaste, and if you can just kind of do the math and figure out if you're going through it in the right amount of time. So again, I use this because we were treating hyperpigmentation. I am not opposed to botanical tyrosinase inhibitors and things like that treat pigment, because I actually believe in pulsing on and off of hydroquinone. So there is absolutely a place for that, and we do use that in our office. One of the things that's really important for us is because we do laser treatments here and the doctor does full coverage laser resurfacing, we really want to be able to precondition the skin prior to treatment, which will reduce the risk of complications and enhance results. And then post-treatment, once they're recovered, we can put them back on a system like this to further enhance results. And if somebody were to get some post-inflammatory hyperpigmentation, which is truthfully a risk with any procedure that causes inflammation, this is how we would go in and correct it. And you can actually correct it relatively quickly. A darker skin type is going to take a little bit longer and need more stimulation, but if we didn't have something like this available in a practice like ours, it would be really hard to do our job, because we do a lot of treatments where there is inflammation, and that is actually like a necessary evil. We're trying to get an inflammatory wound healing response in many cases to stimulate collagen production. All right, thank you.